medical emergencies, diabetic ketoacidosis, and the hyperosmolar hyperglycemic state. There are two types of hyperglycemic emergencies that can affect a resident with diabetes. One is called DKA, which stands for diabetic ketoacidosis. Another is known as HHS, which means hyperosmolar hyperglycemic state. As a healthcare provider, it is important to recognize and understand these conditions. The two conditions are caused by a lack of insulin needed to control blood glucose levels. Common triggers of DKA and HHS are infections and illnesses. These include pneumonia, heart attack, stroke, gastrointestinal bleed, pancreatitis, and urinary tract infections. These can account for 30 to 50% of the cases. Early symptoms are excessive thirst, frequent urination, dry mouth, and high blood glucose levels. DKA is more common in type 1 diabetes, while HHS typically occurs in type 2 diabetes. The frail elderly are at greatest risk for HHS. If not treated, either condition can progress to seizures and coma, which can be fatal if not treated. First, we will explore DKA. DKA is more common in people with type 1 diabetes and is always caused by a lack of insulin. When there is not enough insulin available to transport glucose into the body cells, the glucose accumulates in the blood at extremely high levels. Once the glucose level in the blood rises to over 14 millimoles per liter and remains at this level, DKA can develop very quickly within a 24-hour period. When there is a lack of insulin, the body uses its fat stores for energy instead of glucose. The waste product of this process is ketones, which are acids. Ketone bodies accumulate in the blood and spill over into the urine. This can result in symptoms of excessive fatigue, abdominal pain, nausea and vomiting, fruity odor to breath, intense thirst, frequent urination, and deep and rapid breathing. DKA can be avoided by checking blood glucose levels regularly. If greater than 14 millimoles per liter, check for ketones in the urine by using ketone test strips. When a person is ill, blood glucose and ketone tests should be done more frequently. Signs of DKA include high blood glucose, ketones in the blood or urine, dehydration, drowsiness, and confusion. DKA can also be avoided if insulin is given as prescribed. An order for a temporary increase in insulin may be needed. Be sure to assess and treat any underlying illness. The second emergency state we will explore is HHS, hyperosmolar hyperglycemic state. This condition occurs mainly in people with type 2 diabetes whose insulin resistance prevents glucose from entering the cells properly, leading to its accumulation in the blood. When blood glucose levels rise, the resident may feel extremely thirsty and tired. However, the frail elderly resident may not be able to feel or communicate their thirst. Common triggers of HHS are infection and illness. Extreme stress on the body, such as surgery and certain medications like prednisone, can also lead to HHS. Impaired kidney function can cause difficulty in eliminating excess glucose in the blood through the urine. HHS is detected by high blood glucose levels, usually greater than 30 millimoles per liter, and by severe dehydration. It can develop slowly, on average around 12 days. It does not cause abdominal pain, so it is often overlooked or misdiagnosed. There is usually no accumulation of ketones because in type 2 diabetes, a small amount of insulin is still produced, which is usually enough to prevent the breakdown of fats. To avoid HHS, ensure the resident stays hydrated and give at least 250 milliliters of water every hour when blood glucose levels are elevated. Also, be sure to measure blood glucose levels frequently during times of illness or extreme stress. Lastly, give insulin and oral anti-hyperglycemic agents as prescribed. Signs of HHS include severely high blood glucose levels, extreme dehydration, an absence of significant ketones, extreme weakness, confusion, the inability to speak, and seizures. Some prevention goals for DKA and HHS include regularly monitoring those at risk, addressing any underlying infection or illness, correcting elevated blood glucose levels, and rehydrating the resident by administering fluids. Depending on the severity of the situation and the instructions of the physician, the resident may be transferred to hospital for treatment. For further information, refer to the Sick Day Management module. DKA and HHS are emergency conditions that should be part of an ongoing assessment in all residents with diabetes. This chart summarizes the differences between DKA and HHS. In the elderly, typical symptoms may not occur at all. Typical symptoms include elevated blood glucose, unusual thirst, frequent urination, or a change in appetite. It is important to note that typical signs or symptoms related to elevated blood glucose levels may be different for the long-term care resident. The elderly do not always feel thirst or are unable to communicate their needs or hydrate themselves. Recognition and treatment of these two emergencies is very important in the elderly population to prevent further complications and death.